Picture this. A person walks into your room. They haven't said a single word, haven't shown you a single medical record, yet you already know exactly what's wrong with them. Sounds like magic? It's not. It's the art of visual diagnosis. Today, we are going to learn how to read a person's illnesses like an open book. And the first most important rule you need to grasp is this. When someone comes to you, don't forget to smell them. Before you even look at who they are, pay attention to how they smell. If we haven't met yet, my name is Alex. Over my 13 plus years working as a doctor, I've seen thousands of patients. And I can tell you right now, many doctors can diagnose you just by looking at you. That's why very often I know what health issues a person has within the first few minutes of meeting them. And so, we are kicking off a series of lectures where I will teach you exactly what to look for in a person's appearance. Of course, I have to give a quick disclaimer. Today, we are discussing alternative and folk diagnostic methods. This knowledge is invaluable for understanding your own body, but it does not replace going to a doctor or getting traditional lab tests. Our goal here is to learn how to spot the warning signs. So, what kind of smells are we talking about? If a person's breath smells very strong, sharp, and foul, like a rotting smell, write this down. That's pancreatitis. Think about it. You probably know someone whose breath smells like something is decaying, right? If the smell is strictly putrid, it means the person is in a severe phase of pancreatitis, which can develop into a purulent form, sometimes even requiring surgical removal. Moreover, if the breath smells like Pseudomonas aeruginosa, a distinct, sweet, or rotting odor, for a long time, it could be an early warning sign of developing pancreatic cancer. What if the breath smells sour or bitter? That can be the very first sign of diabetes. But there's another issue. Have you ever noticed people getting these weird, foul-smelling white chunks in their mouth? They go to the doctor, get diagnosed with laryngitis, and are told to gargle. But it doesn't help. Gargle all you want. They keep coming back. Do you know why? Because the problem isn't in the throat at all. These chunks are actually bacterial buildups forming in the esophagus. And now, I'm going to reveal the secret of why they appear. It happens when a person eats incredibly hot food or drinks scalding tea. People say, "Oh, I love my tea so hot that it's steaming." But in reality, this scalding mixture burns the tissues of the esophagus or stomach. The tissues die, lose their muscle tone, fibrosis sets in, and a small pouch forms, a hiatal hernia. That's exactly where these smelly bacterial chunks accumulate. So forget the myth that you need to drink boiling water to warm up your gut. It's a dangerous reactive habit that kills your tissues. So how do we help an esophagus like that? In folk medicine, there are two interesting methods. The first is sipping pure lemon juice, little by little, throughout the day. If it causes an incredible burning sensation in the esophagus, that's actually considered a good thing in this practice. It means the damaged areas are being exposed and disinfected. Attention, I must warn you here. If you have ulcers or erosions, pure lemon juice can cause severe chemical burns and make things much worse. Please be extremely careful with this method. The second folk method involves a drop of iodine. You take 1 drop of iodine, mix it quickly into a tablespoon of milk, and drink it right before bed, at least 2 to 3 hours after eating. It's believed that this stops inflammatory processes. Again, a warning for the audience. Ingesting iodine is dangerous for your thyroid gland. This method is mentioned strictly for informational purposes. Now, let's move from breath to body odor. Sometimes, a person sits down in front of you and they smell like they haven't showered in ages. If it's a woman, she might make excuses. "Oh, my hormones are just acting up." Don't look for abstract hormonal imbalances. The smell of an unwashed body is a 100% indicator of one of three problems. First, excessively high testosterone levels. Second, diabetes or fluctuating insulin levels. These are endocrine system issues. And third, anemia. With anemia, the body of an adult or a child starts smelling unwashed. Why? Because hemoglobin is our little boat that carries oxygen, and oxygen is the most powerful oxidizer in our blood. It takes on the job of deoxidizing and destroying toxic substances. No hemoglobin means no oxygen, which means toxins aren't being destroyed, and the body starts giving off a heavy odor. Remember this: our body is constantly talking to us. It sends signals through smells, colors, and shapes. And if you learn to understand this language, you'll be able to spot a problem long before it becomes critical. In our next lecture, we'll move our gaze a little higher and discuss how your hair, your posture, and the way you hold your head give away your hidden diagnoses. Let's continue our diagnosis. You've already checked their smell and assessed their breath. What's next? Next, the person just sits in front of you and you start scanning their physical appearance. The first thing that catches your eye is their hair. If the hair looks clumped together, hanging in thin, stringy icicles at the ends, don't rush to assume the person is just dirty. Often, people wash their hair thoroughly, but it still looks unkempt. My friends, this is a sure sign of an underactive thyroid. No matter how much you treat your hair with shampoos, as long as the gland is underperforming, the hair will keep clumping together. What if the hair looks beautiful at the ends, but seems to grow greasy and unnatural right at the roots? Most likely, this points to vascular sclerosis. Dry, brittle ends? Check the spleen and rule out anemia. And what if the hair is falling out rapidly? This could be a sign of intense stress when a person doesn't know how to calm down, especially at night, or a vivid manifestation of active hypothyroidism. In the rare case of Wilson's disease, hair also falls out in clumps, but new hair grows back rapidly. Next, pay attention to how the person holds their head. If their head is constantly tilted to the side, left or right, you're likely looking at someone with vegetative vascular dystonia or spasms in their cervical arteries, and they almost certainly have issues with their neck vertebrae. Ask them immediately, do you experience ringing in your head or ears? Is your vision getting blurry? Listen to how they cough. If the person says they feel like something is building up in their throat, that's allergies. But if nothing is coming up and it's just a dry, endless rumbling and spasming, check the thyroid. It could be Graves' disease. Let's make a quick disclaimer. It's crucial to understand a cough can be a symptom of dozens of different illnesses. Alternative visual diagnostics give us great clues, but you cannot definitively diagnose Graves' disease or sclerosis just based on a head tilt or a cough. It's a reason to go get a specialized ultrasound and check your hormone levels. Moving further down, posture and neck. Shoulders rolled forward, person is slouching. This might indicate hypertension or heart defects. Shoulders pulled back, but the chest has a keeled shape. That points to vitamin deficiency, protein absorption issues, and bowel problems. Look at the patient's neck. If the tendons on the neck are stretched to the limit, every muscle defined and compressed like a coiled spring, you have someone suffering from severe neurosis, obsessive thoughts, or panic attacks. You know the neck is a traitor. If it's that tense, the person almost certainly suffers from insomnia. Such people usually talk very fast. They are impulsive, eccentric, and live in a state of perpetual euphoria that completely exhausts their nervous system. Now, ask them to place their hands in front of them and look at their hands. Puffy, swollen hands are the first signal of kidney failure. Unusually large hands, a tendency for tissue thrombosis. Ask the person to make a fist. If they tell you they can't squeeze their fingers all the way, These are the first signs that their kidneys have stopped working properly. Tell them to measure their daily urine output. If they're passing more than 3 liters a day, their body is losing vital fluids. If the fingertips are turning blue, that points to vegetative vascular dystonia, vascular spasms, or neurosis. Or, even scarier, it's the first sign of scleroderma. There's a clever trick in folk medicine for this. Shine a flashlight under the nail to illuminate the skin. If you can see a web of countless tiny coagulated blood vessels in the center, it could confirm scleroderma. And since we're on the topic of fingers, let's look at the nails. See white spots under the nails? Many people think, oh, I just need more vitamins or calcium. Not at all. Those are immune system issues, allergies, or the aftermath of a viral lung infection. Wavy nails often indicate high acidity in the gastrointestinal tract or spleen damage. Are all the nails cracking? That's pancreatitis and diabetes. Again, friends, remember the rule: do no harm. Blue hands, swelling, or weird nails are a reason to run to a rheumatologist, cardiologist, or nephrologist. We are learning to read the body's red flags, but trying to treat kidney failure with just a diet without a doctor's supervision is deadly. And the last point for this segment: stand up and look at the person's belly, or your own. A very large, swollen belly, the kidneys are failing. But what if the belly is sticking out right at the level of the pancreas? That is a clear signal of pancreatic issues, most likely the early stages of diabetes. See how much information we've gathered without even touching a medical chart? In the next lecture, things will get even more fascinating and incredible. Subscribe and hit the like button. Share your thoughts in the comments below.